Hi, everyone. My name is Pablo Ramos, and thank you so much for joining us for this incredible event in partnership with the Ad Council and the COVID Collaborative. As you know, over a year and a half ago, we were completely changed by the pandemic. Specifically, the Latino community was disproportionately affected by COVID-19. On average, to this day, Latinos were twice as likely than white people to be infected, to be hospitalized, and to die from COVID-19. In a research Pew study found that over 50% of Latinos in the community know someone close to them that has either died from the pandemic or that has been hospitalized. And while all of this reality was taking place, many of our people, many Latinos were considered essential workers. Many were farm workers, many were housekeepers, first responders, healthcare workers. Our people kept the country safe, clean, and fed. Throughout all of this time, the Latino community hasn't just been battling a war against the pandemic. We've also been battling a war against mis and disinformation. And as we've reported at Vice News time and time again, Spanish-speaking Latinos have actually become the perfect victims of disinformation. And that's exactly why we're here today. Now, we've come together to help one another stay safe, to help one another stay healthy, but more than anything, to help us remain informed, which is why I'm so grateful to be here with you today. And more than anything, I'm so grateful to be joined here by Maria Cardona, a CNN and CNN in Espanol commentator. She's also been doing an incredible job spearheading this event in conjunction with the Ad Council and the COVID Collaborative, creating education and information campaigns that are specifically targeted with us in mind, with Latinos in mind, to get us the information we need to stay informed. So thank you, Maria, so much for being here. Thank you for co-hosting this event with me. We are so, so grateful to have you.
Thank you so much, Paola. I am so happy to be here co-hosting this amazing event with you. And I feel like we're kind of coming full circle because, as you recall, you were kind enough at the very beginning of this campaign to lend us your talents for our very first national event, which was an incredible success. And it was called Las Marias. And it was all about starting to inform our community about the importance of the COVID-19 vaccines and trying to answer some of their questions and the doubts that they have. So now here we are, 6 months later, we have now surpassed the sad number of over 700,000 American deaths, including over 123,000 Latinos. And it doesn't have to be this way. We are still at a moment where much more of our community needs to be vaccinated. And so what this campaign is all about, the Ad Council and the COVID Collaborative have been doing extraordinary work in this unprecedented and historic campaign that is focused on continuing to inform and educate the Latino community in order to make sure that they have all of the necessary resources they need in order to make an informed decision to get vaccinated against COVID-19. They've been doing so much, including conducting a variety of teletown halls, national events, phone calls. We've had Instagram posts, we've had Twitter town halls, we've done them with medical experts, with community leaders, with religious leaders. We've done them in English, we've done them in Spanish, we've even done them in Spanglish. And what I think we've really been able to do is to reach those most hard to reach participants and community members within the Latino community all across the country. The other thing that the Ad Council has that has been offered to community leaders is a first of its kind Hispanic community toolkit for community leaders and all of the organizations that are doing the hard work on the ground at the grassroots level to continue to educate and to make available this information, which, as you know, is sometimes really hard to come by because of all of the misinformation and disinformation that is out there. So this Hispanic community toolkit has been really critical to put the tools in the hands of all of our community leaders, many of which we'll be speaking to here tonight, that are doing the hard work of educating our community. They are trying to reach and they are trying to speak to all Latinos wherever they live and work.
Maria, that sounds like incredible work that you're doing with the Ad Council and the COVID Collaborative, which is a perfect segue into our next panel. We're joined here today by 3 experts in the medical field.
Thank you for having me.
Thank you all for joining us. What a great panel. We have a lot of questions for all of you today. Let me start with you, Dr. Shapiro. There have been reports that the Pfizer vaccine is safe for children between ages 5 and 11. However, it still has not been granted FDA approval. And we also know that the Moderna and the Johnson & Johnson vaccine are also testing their vaccines for children 5 to 11. What are you saying to parents who are concerned and who might be hesitant when the vaccine comes out that perhaps it hasn't been tested enough?
First of all, thank you so much for the question, because apart from being a pediatrician, I'm also a father of 2 that will be in that category to actually get the vaccine. It's okay to have questions. It's okay to have, a lot of doubt and fear, because we want to protect our kids. One of the things that I did during my research and figure out, what's the best option to protect my kiddos, was to figure out what the data tells me. And right now, we have seen in the past weeks how more than 1 million new cases of COVID-19 affected kids. That's more than 1/5 of all the cases during the entire pandemic. That means that the kids with the Delta variant, and also right now they're going back to school, they're more exposed and they're having more complications. And of course, I want to protect them. And one of the best things that I can do for them is make sure that they have, a vaccine that it's safe. And not only safe, but it's actually efficient on protecting them against, hospitalizations and the prolonged COVID that also kids are having.
Those are really important points for us to take in mind. Jacqueline, as you know, recently Pfizer announced a breakthrough pill that could essentially treat COVID-19 once a person contracts the virus. Obviously, this is incredible news. It's a huge development, but do you have any concern that this could actually lead to even more vaccine hesitancy? I mean, do you think this will just be another excuse for people to not get the vaccine?
So this is an interesting approach. So yes, I would say there may be hesitancy that will come with any new medication or device, especially in a pandemic with the COVID, such as we're living through right now. But I would say to really, as a patient and as a provider, think about disease as prevention. That's really what you want to think about and be proactive, right? If any treatment that comes out will be embraced and will be helpful in our toolbox. But ultimately, the goal will be to prevent disease, and that's really should be the main message that's honed in, because any medication will have potential adverse effects, right? We all know that. And so if we can get ahead of the game and prevent disease, then that's way better. The prognosis will be way better. And I think ultimately that's what we need to focus on, like as patients and providers think about disease prevention, not just treating the disease or the aftermath of problems that can come from a disease, but ultimately thinking about changing that perspective and being proactive in ensuring that we get vaccinated. And the way I tell patients and the way we talk about this in medicine all the time when we weigh out risks and benefits is about, you do not want to take a chance, right? It's all about risks, and you want to take a chance on getting exposed to the actual virus and then taking the chance of contracting all of the complications that can come, including death. So if you put it in that paradigm, in that perspective, that if we can prevent disease and prevent all the consequences from that, then that is a much better trajectory across the board for all patients, especially patients with underlying pre-existing conditions. So thinking about it as prevention, and even though this pill or another injectable or whatnot, some other tool comes out, I think that's great. It'll be another asset to use in our toolbox, but ultimately prevention should definitely be the main focus. And I think if we stay on track with that, then that will make the world a difference for everybody.
Here's one that I have gotten from so many folks ever since this news came out. Unidos US has reported that Latino children are 3 times more likely to be hospitalized for COVID-19 compared to the white counterparts. What can Latino parents do to keep their children safe now that everyone is back in schools? We are doing so much more in person now that we're focused on holiday gatherings coming up, Halloween is coming up. What do you tell families to make sure that they feel confident that they can keep their kids safe?
The first thing is that we need to understand why is this happening. Our families in the Hispano community are working 2 or 3 jobs. They're doing essential work. They're more exposed than other families in other counterparts in the community. Then the more exposure we have, the more possibilities of us contracting the virus and bringing it at home. Also, the rates of diabetes, obesity, and other problems that we have inside of our community do not help the cause. And there's something called social determinants of health. That's, what's happening with, food, what's happening with green spaces, what's happening with environmental, counterparts. If it's a polluted area, the lungs are not as good to defend itself against viruses. And there's a lot of things that are piling up that go against the Hispano community. And of course, the things that we need to be doing is continue doing the social distancing, continue washing our hands, making sure that we are all integrated with the vaccine. And even if kids younger than 12 cannot get vaccinated, if family members are vaccinated, that reduces the opportunity for the virus to jump from one person to another. And that's why it's amazing things that we can actually use to protect our families, no matter where we are.
Just to echo what Dr. Shapiro mentioned just now, the Unidos US report was actually really important in highlighting and amplifying the data around the interest and the importance of protecting their children, right? So Latino parents, Latino families want to protect their children and are actually in support of vaccines and vaccine mandates. But what does this mean as we start to gear up for holiday season? What we saw with our Juntos Si Podemos campaign back in August when schools were reopening was that there was a lot of questions from around the country on what this means for their kids. So if their kids are going back to school, should we vaccinate? Should we wait? Should we, there was a number of questions around the effects of a vaccine on their children. And so now that the holidays are approaching, we see that though there is still a priority in Latino familias to prioritize the safety and the protection of their kids, there is also going to be, as you mentioned, an increase in large gatherings. And so as we continue to plan for those gatherings, we want to make sure that we're protected. And so this is really where making sure we have the information of the vaccine comes into play, and asking the questions that you have. So if you are a parent that has a question, we definitely encourage you to ask your questions with us, because that is why we are here. We are here for you.
Definitely. Jacqueline, as you know, Latino children are still more likely to get COVID-19 than white children. And this is something that we keep hearing time and time again. Why is there this discrepancy? And more than anything, what advice would you give some Latino parents that want to keep their children safe?
Yeah, so that's a good question. So unfortunately, there are many healthcare disparities. And what do I mean by that? So healthcare disparities include barriers to healthcare access, barriers to health literacy, barriers to transportation to and from clinic and points of healthcare services. So historically, unfortunately, marginalized populations, including minority populations, including racial populations such as Latinos, African Americans, Asian Americans, and the list goes on, are impacted at higher rates of infection. And sometimes that goes back to social economics as well. It can be a very complex, very difficult situation to deal with, especially when right now, it can be heartbreaking. We see so many signs and advertisements and charlas and all this information that's bombarding people. And sometimes it's hard to ensure that the people most vulnerable will have access to that. And unfortunately, that's not the case. So I think I'm thankful for these type of, Zoom meetings and, virtual gatherings that we can have virtual, that we can spread the message and hopefully bring down these rates of infection and improve the prognosis of all patients, including minorities. So I think, there's a lot of work that needs to be done, but being conscientious of those barriers and working as a community, bringing in social workers, bringing in free clinics, bringing into the health department and ways that we can all work together to ensure that everybody has access to these healthcare services, to these vaccines, to these life-saving treatments.
Dr. Shapiro, I want to ask you about an alarming trend that we've been reading about. There are people that, instead of wanting to get vaccinated, have asked their doctors when they get sick to be treated with a horse dewormer called Ivormectin. This is something that even the FDA has said is very unsafe. What do you say to those who believe that ivermectin can work? And how do we battle this issue of misinformation and disinformation, especially in the Latino community?
The reality about this medication, it works, but it doesn't work against COVID-19. That's the important thing. It does have an amazing way of protecting us against certain parasitic infections in humans and other animals. But at this moment, changing what we know, and we have tried it, and trust me, we have tried it a lot to have like an amazing medication to decrease the inflammation and make a difference. But ivermectin has not been the one that we need right now. We have seen that, on labs, that it makes a difference in little cells. We have seen it in certain models in animals. But when you can try to translate that research into humans, that's when it actually breaks. There's a couple of research papers that are very small in different countries, but the big papers where you prove in intensive care unit with a lot of patients and it's standardized the way that it's supposed to be, it hasn't shown a difference. And I would love to be the voice of bringing good news on this one, but right now ivermectin is not the medication that we need to be using. That's why it's kind of using just for your diabetes, using only chamomile tea. It's not going to work. It's not going to work. And yes, we want to use things that we have out there in the community, and on that void of misinformation and trying to do something, we tend to look for an answer, but this medication is not the one.
One of the things that continues to come up in a lot of the conversations I've had with many Latinas that are hesitant to get the vaccine is this idea of infertility, right? Many women have told me that they're scared that the COVID-19 vaccine will not allow them to get pregnant in the future. How do we address those fears?
Yes, this is a really important one. And unfortunately, again, there's a lot of disinformation and misinformation around how vaccines in general, not just COVID-19 vaccines, but a lot of different vaccines, including the flu vaccine, which is also coming up. And so how does this affect women, especially women's fertility, pregnancy, or whether or not they're nursing, breastfeeding their child? And so as we address those fears, again, it really comes down to understanding what is the fear? What have you heard? And how can we come together around you as a support system to address those fears and reassure you that the vaccine does not impact the child that you're pregnant with, or that you're trying to have, or that you're breastfeeding. And so again, it really comes down to just understanding the women, understanding the community. And I want to make another shout out to promotores who have been so powerful and so intricate in addressing those issues and these issues around misinformation.
Ms. Sosa, right now where you're seeing some of the numbers of infections and deaths starting to level out, which is good news. Should we still be, though, on the lookout and concerned about perhaps another variant coming down the pike or another surge?
Thank you, Maria. Yes, this is actually a really interesting question. We've been met a lot with this question. And in fact, what I've been noticing in the news is talk of another potential variant that has emerged. What we saw in the pandemic, and I'll definitely look to the other panelists for additional context on this. But what we've seen is a number of variants have emerged from the original COVID-19 virus. And this started in 2020. Right. And so the latest variant that we're familiar with, of course, is the Delta variant, and the difference in severity, the difference in transmission rates, and how this impacts the vaccine, the effectiveness of the vaccine, right? And so I think because we are still in the middle of this pandemic, it is vital for us as a community, as leaders, as partners, to continue to fight misinformation, but to also continue to be aware of what the virus is doing. And especially now, as we start to see more gatherings coming together with Thanksgiving and Christmas and other big family gatherings for the end of this 2021, it is so important for us to be wary of what is out there. And so I cannot give a direct answer as to whether or not I believe another surge or variant will definitely happen. But what I can say is that there is a possibility. And if there is a possibility, that is more than enough reason for us to continue to practice safety, to continue to follow the safety guidelines that the CDC has recommended, and for us to continue to be aware of our community, of our loved ones, and how we can protect them through our actions.
Jacqueline, as we know right now in the news, one of the biggest topics right now is our boosters. You know, should people get them? Should they not? We know that Pfizer already approved a third dose. So should we be expecting the same thing from Moderna and from Johnson & Johnson? I think more than anything, how do you address the concerns of people that don't really know what the point is of getting a booster?
So the purpose of these third vaccine boosters is that once when we all get the initial vaccine or any other any vaccination, matter of fact, there is a time period where our body mounts an immune response, and that means that our body forms antibodies against the vaccine, that be it COVID vaccine, be it hepatitis vaccine, be it mumps, measles, rubella. So these vaccinations aren't forever. So these vaccinations give us a boost. It lets your body know that, yes, you've been exposed, or to remember the vaccine in a way that the next time you are actually exposed to the live virus, then your body will have memory and mount an appropriate defense. So that being said, these vaccines will need a booster. And it's no different than hepatitis vaccine, for example. Hepatitis vaccine, a lot of healthcare workers, we get checked periodically to make sure that we are not putting our patients at risk, and that we are not at risk either, right? Because we were in this very, it could be dangerous, this profession. So understanding that concept, that this vaccine isn't just a one-time thing, it will require maintenance. Like no difference that I guess explain to my patients that, your car needs, and it's not silly, but your car needs maintenance, right? And you go every certain miles you go, you get an oil change, every certain miles you do transmission check, etc. So it's our bodies too. Our bodies are amazing, that how they work, how they can protect us. But yes, we're going to need a booster just by the mechanism of action and just the way the vaccinations work. It's not a one-time solution. It will require a booster, and acknowledging that and being very open with their patients about that and explaining that to them in a way that they'll understand and that they'll be welcoming of and accepting of the third vaccine.
Piggybacking on Paula's last question, Dr. Shapiro, many people have felt strong side effects with their second dose. Will each additional booster shot have similar side effects? What can people expect? And are you afraid that they might be afraid to get that booster shot since their second one was so painful? What do you tell them?
Right now, it takes around the same level of the things that we have before. It's extremely important to know that it doesn't mean that if you already had it, and the side effect, that it can be different. And most importantly, it changes. It changes. But the reality is, expect some redness on the area, expect some pain, some fever, and that's kind of about what we will be seeing.
Thank you all so much for taking the time to join us here today. The points you all made are so incredibly important, and they will save lives. So gracias.
Thank you for having us.
It's always a pleasure, and I'm here. And this is the moment that we need to continue vaccinating our communities against fear with a dose of truth.
Thank you so much. On behalf of the Latinx Task Force, we are extremely excited and looking forward to getting out of this pandemic together. Gracias.
Thank you so much to our experts. The three of you have given us incredible information, very helpful information to keep in mind. So thank you again. And now we are going to shift our conversation, and we'll be having a conversation with some leaders in the community, leaders that in different ways have been affected by the pandemic.
Thank you so much for having us and covering this really important topic.
Adriana, can you talk a little bit about how Latinos' mental health has been deeply affected by this pandemic?
Maria and Paola, thank you so much for having me here today. I'm so excited to be with you here, share this conversation and dive into this important topic. I think mental health has been greatly affected by the COVID-19 pandemic. It's an issue that as the Latino community, we don't talk about. It's often very taboo, and we are very hesitant to share our struggles and where we're at with mental health. It's just not something we talk about, unfortunately. And with the COVID-19 pandemic, the way we interact with each other and the way we form and share our joy and our love was completely eradicated. You know, we're people that are based around community and sharing and togetherness. And with COVID-19, we weren't able to do that. So the way we show up for each other, the way we interacted with the world was incredibly affected. So it shouldn't be a surprise at all that our mental health was impacted by this insane pandemic, yet it's something that we don't talk about, which just exacerbates the problem and the issue. So I'm so happy that we're here today and we can dive into this conversation and share some resources and some important thinking about what to do to address the issue and move that conversation forward and make sure that your community, your loved ones, and everybody around you is taken care of.
So as you know, mental health has traditionally been considered a taboo among Latinos. It's something that we simply don't talk about. And I think that was made even worse during the pandemic. So Christina, why don't we start with you? What advice would you give to some Latinos that are struggling, but that want to seek help? What would you tell them?
Well, that's a question that I think we could all talk about for, an entire series rather than just a segment, but it is something that I can relate to. It's something that I've personally gone through. And again, I went through it in a time when there wasn't a global pandemic, when we hadn't been through four of the most visceral years in our country when it came to our community and things that we were going through. So I understand it. I don't know what the answer is. I will say that, the first step almost is just making sure that you're okay with it yourself. And sometimes that's the hardest, right? You come from a generation, particularly in my family, the women, the Latinas in my family are so strong and so driven that the first step for me to going to get kind of help and finding somebody to help me out with my mental health situation. And I'm the first to, kind of speak it into existence now. I have been diagnosed with depression and anxiety, and it's something that I will live with for the rest of my life. And it's almost empowering now to be able to know that. But I remember before I went to a therapist and before I started to actually get treated, that it was almost a whole other level of anxiety to kind of admit to my family or admit to my friends that I was going to go to therapy. And it was very interesting because a lot of my white American friends had been in therapy, or families had therapists, or, it was kind of just something. And that's not to say that it's much more prevalent, but it seemed to be more accepted. And so I think one of the first things to realize is that it's not admitting, it's just saying I'm adding, so to speak, another tool to my toolbox and how I'm going to be successful. And I think if we can start to change that mindset in our community, that it's not treating something and it's not showing a weakness, but instead it's actually arming yourself to be more successful, to have a better life, to be a better friend, to be a better daughter, to be a better sister, whatever it is. Because I think sometimes, especially for some of us who are first generations and we've seen our mothers and moms, abuelas, everybody go through what they went through to get us here, you almost feel like you're doing something wrong, when in fact you're doing something right. Because when you're able to help yourself out, you can help your family even more, which is something that is usually, very important to all of us.
Can you share any reliable resources with us that can help Latinos have conversations, receive help surrounding mental health issues?
Yes. So Maria, one of the things we have done is actually created a resource center to address some of the issues that are coming up during the pandemic. And I'd like to share that phone number if it's okay with you, with the audience. But anyone can call anywhere around the country, can call this number, ask for any support, whether it's mental health or whether it's a question around vaccine hesitancy, or just questions around COVID, or questions around other vaccines that adults should be taking. So I invite you all to reach out to the National Hispanic Council on Aging and speak with a specialist who can guide you and provide some support. So here's the number. It is 1-866-488-7379. So that is a number that is available, and we're happy to help in English, in Spanish, or in Portuguese.
You know, there's this narrative among young Latinos that we're fighters, no? That we're invincible. And I think that's led some young Latinos to think that they don't need the COVID-19 vaccine. So what would you tell these young Latinos that feel like they can beat this virus?
I believe that the biggest challenge that we have seen in our community when it comes to vaccines and education about the vaccine is that there is too much misinformation that has been repackaged, myths that have been debunked in English and that now are being repackaged into Spanish. So it takes a long time for people to really get the information that they need, the way that they need it, and in their language that they need it. So for us as an organization, we have been working closely with many different organizations across the country to really listen to what is that hesitation or that anxiety that people may have, but at the same time, giving them the facts. I believe that our community is not really hesitant, but more hungry for information. And we are seeing right now the numbers across the country on how the Latino community is doing better than many other communities. In fact, the #1 vaccination place in the country is Puerto Rico. So that means that if you are able to provide this information that is culturally competent in their language, and there is no politicization on the issue of the vaccine, it is possible for our community, and our community is listening. So what we want to do is just to tell people, we understand if you're nervous, we understand if you have questions, but we're here to answer them. And of course, always encouraging people to not only doing it for themselves, but to do it also for their loved ones and for their community. This is something that we need to do not for just one person, it's for everybody. And the faster that we do it, the faster that we go back to those pre-pandemic times.
I can think back to times when I was somewhat like this person we're discussing here, this young person that thinks, you know what, I'm healthy, I'm invincible, I'm this, I'm that. I was a college athlete. You know, I regularly stay in shape. I've got, you know, God bless me with decent genes as well. Luckily, haven't had history of much illness in my family and things like that. And so I can think back to times, specifically, I didn't get the flu shot. I'm not saying that COVID is anything like the flu, but I can understand where that mindset comes from. And then at the same time, now, after learning so much, I understand that I have additional insight. But I don't even think you need additional insight to understand it. I think the simple thing you need to, that folks, young folks, I'd like to consider myself still young at this point, we need to understand that the only reason we are healthy and we are where we are at the point of our life is because we have been receiving vaccines since almost the day we were born. You know, you talk to any first-time parents, and some of the most gut-wrenching times in their lives are those doctor's appointments where they have to go and take their baby to get 3 or 4 shots at once, right? We are only able to live as long as we do and be as healthy as we are because of the advancements in medicine that have been made since we've been alive or before we were alive. There's a reason we don't get polio. There's a reason people don't oftentimes die of chickenpox. All of these different things did not just happen naturally. We didn't just evolve into some type of greater species. No, we have all gotten vaccinated.
We've always been plagued by the issue of domestic violence, but quarantining and lockdowns have increased instances of domestic violence throughout the country. What would you say to those who are in that situation, but are hesitant to call the police because of fear of their own situation, perhaps deportation, perhaps they're undocumented. What do you tell those folks in our community?
Oof, Maria, that's a really important one, and I'm glad that we're getting to this topic. It's been absolutely ravishing our community, and it's awful the reality of the data and numbers that are coming back around that issue. It's, as you mentioned, it's something that's always plagued our community, but now more than ever during lockdown, I think that came to be seen in a much deeper way. I would say, again, you are worth it, and you have to make the choices for your own life. I think a lot of the stigma that our community faces is around understanding domestic violence beyond what we typically imagine it to be. It's not only the physical altercations and the physical harm that can be done to you, which is absolutely insanely awful and should not be happening, but there's so many other versions of it. There's the fear of deportation. There is the threatening of taking the kids away. There is the isolation of keeping you away from the rest of your family, the rest of your community. There is the idea of also sort of taking all your documentation away, so you have no choice, but you do have a choice. And there's resources out there, and there's people that are willing and want to help. But you have to speak up, and you have to do it for yourself, and just know that by reaching across and finding a community that can help and support you, you will find love, and you will find a better life for yourself and for your family if that is your situation as well.
So what resources are you able to share for those women or men that may be in domestic violence situations?
Sometimes individuals don't even know that they're in a circumstance that is considered domestic violence. So I would send anyone to esperanzaunited.org. You can look at the resources that they have under their Get Help Now section, and you can ask questions. Is this abuse? What are my rights as an immigrant? How can I help a friend? What are the resources that are available to me? So go and find out everything that you can and understand what the circumstances are that you're living in, and then what are the ways that you can handle the situation.
Thank you so much to all of our leaders. Your thoughtful insights are greatly appreciated, and you have shared some important life-saving information with our communities. We now have a few questions from the audience.
They're asking, what can people do to encourage their friends to get vaccinated against COVID-19?
It's a great question. All that we need to do is to start a conversation, really understand the reasons why people are not taking the step. But the vaccines work, and that is the basic that we need to discuss with people. Over 189 million Americans have been fully vaccinated, and the COVID vaccine is highly effective. They protect you from severe illness. We know that people that are vaccinated have a higher chance of being protected, not only from the COVID-19 virus, but if for some reason they get infected, they don't have severe symptoms, and it prevents them from hospitalization and, for the most part, from life-threatening diseases. So we know that we need to make sure, or life-threatening complications. So we need to understand that vaccines work. We have seen it with other types of diseases around the world and in the United States. Smallpox, polio, measles, mumps, rubella, others, many others. Vaccines work, and we're seeing it right now with the number of not only infections going down, but also deaths or even hospitalizations. So for us, the best way to go back to normal, to our lives, our economy, and to the betterment of all our community, and to prevent more variants of these potential new variants with the virus, the best way to do this is by stating the fact, seeing the numbers, follow the signs, and have conversation. And everybody needs to get vaccinated.
Our second questioner wants to know what additional resources your organization provides for Latinos to help them in these tough times during this pandemic? Are there hotlines? Are there websites that you can share?
One of the things that my organization, MANA, has been working on is to work with other national organizations to elevate the needs of our underserved and Latino communities, to make sure that any of the solutions that are coming for COVID are really taking our communities into account, our particular needs, our linguistic needs, and to make sure that we're kept top of mind because our communities are being impacted at the highest rates.
Here's our last question from the audience. This is a really relevant one since Dia de los Muertos is right around the corner. And this is perhaps the first year for many families that they're spending without their loved ones. So what advice would you give to many Latino families that are trying to grieve and trying to process this reality in this moment?
What I would say to the families that have lost loved ones during this pandemic is to use their experience and turn that into a message to others so that other families don't have to go through this. So encourage other families to get vaccinated so that they don't have to go through the pain and suffering that they are going through. So turning that sorrow and that loss into a voice that can help others in preventing getting infected with the virus.
Our thoughts and prayers are with all of the familias who lost loved ones during this tough pandemic. But it's not too late to continue to make decisions and to take actions that will keep our families and our communities safe. Make sure to get informed, make sure to get educated, share resources that you all know of. The Ad Council and the COVID Collaborative have a terrific one. They have a great website, and it's www.detidepende.org. And they also have it in Spanish. So please make sure to share this with anyone that you know of that is still looking for information. Thank you all for joining us today to remind us that it is so important to continue to educate ourselves in our communities. We're all working together to ensure to keep all of our families and all of our communities healthy, safe, and happy. Thank you so much.
Thank you so much, Maria. You're absolutely right. We have to continue working together to battle this virus and more than anything, the mis and disinformation out there. So on that note, if you want to continue educating yourself, go to detidepende.org. You'll get the best information out there that will help you make the best decisions for you. Thank you so much for joining us today. Muchas gracias.